Hi, welcome to the Fit and Healthy Show. Today we'll be discussing the topic of hepatitis B and C. There are many different types of hepatitis, A, B, C, D, E, F, G, but I wanted to discuss B and C today because for over the last couple of weeks at my store that I tend to work in Lompoc, I've been getting a lot of my customers coming in being diagnosed with hepatitis B and C. And so I wanted to address the issues as far as what it is, how it's detected, and what you can do about it if you do have it. First of all, the definition obviously of a hepatitis is, and what it definitely brings or comes down to, is it's an inflammation of the liver. The liver gets very inflamed. What happens is hepatitis B and C enters the body either in a hepatitis B form through contaminated blood, shared needle drug usage, sexual contact, contaminated water in developing countries as well. And then hepatitis C, 90% of it tends to be from people who have, or hepatitis C tends to be from drug needle users. But it can also come from contaminated blood. Nowadays, the testings on our blood supply are very, very good. So the detectability of it within the blood supply itself is very good for prevention of contamination for transfusions. When we're talking about what the definition is and what happens with this virus when it enters the body, each of these have incubation periods that I referred to here, hepatitis B being 30 to 180 days and hepatitis B being 15 to 150 days. That's how long it takes before the virus really starts to build itself and hide itself in the body before the immune system will detect it and do something about it. Now, what happens with hepatitis B and C is they hide within the liver cells themselves. So it makes it very, very difficult for the body's immune system to detect when it's there. And particularly if the immune system is very, very compromised or the immune system is weakened from other types of diseases, weakened from medications, particularly like cholesterol-lowering medications or pain-killing medications, weaken the liver. Toxic chemical exposures of some type will weaken the liver as well. Well, what happens is these triggers then, once the liver gets triggered into being weak, the hepatitis B and C viruses expand and go for it. They try to take over the liver and go inside of all the individual liver cells. The body all of a sudden perceives this and goes in and fights it. The problem is, remember, this hepatitis stays within the cells itself. It's not just by itself. It has a host. So when the body's immune system starts attacking, it attacks its own liver cells. So it causes extreme amounts of inflammation and what we call a fibrin buildup or a scar tissue buildup within the liver. When we've got that scar tissue built up in the liver can't properly detoxify, and then the symptoms that we start to see, particularly with hepatitis B. With hepatitis C, oftentimes we don't see many symptoms. It can lay there dormant for 5, 10, 15, 20 years, and you'll not know until that liver function or your immune system gets very, very suppressed. So we look for hepatitis B, we'll tend to see nausea, diarrhea, fatigue, clay-colored stools, weight loss, lack of appetite, fever, the urine gets real dark, jaundice, the skin turns kind of a yellowish color, and then the blood sugars really fluctuate. This is going to be probably more in the chronic issues. In the acute, you're probably not going to see. That's the initial stages of Hep B and C. You're not going to see that, but more in the chronic. If you start seeing these kind of symptoms, you need to get yourself off to the doc. The standard testing procedures are going to be they're going to pull blood, and they're going to check your immunal response. They're going to check your liver enzymes for Hep C, and they're going to check your viral load. The only problem is for Hep C, there's no test where you can go and test and see if you've got Hep C. So all they have is those particular 3 things I just mentioned to detect and guess whether you have Hep C or not. The problem with that lies is there's a lot of medications and drugs out there that will give you these similar false readings. So all you have to have is somebody with a compromised immune system and high liver enzymes, and all of a sudden everybody's flashing Hep C, Hep C. So being aware, there can be a lot of false positives on Hep C diagnosis. when we look at what this turns into or how it becomes chronic, when we're looking at Hep B, only 5 to 10% of the people with Hep B have a chronic Hep B symptoms where you get that liver inflammation, where you can't get rid of it, where it's detectable. So that means the other 90 to 95% fight it off with their own immune system and it's gone. Okay? So just those that tend to have compromised immune systems, or those, once again, that have liver issues, are going to tend to have it develop into a full chronic situation. Now, Hep C, which hides itself, as I mentioned before, more easily, 10 to 20% of people that have Hep C will develop cirrhosis of the liver, and only 1 to 5% will develop cancer. I have two of the customers that came in this week were scared to death because cancer, their doctor was saying cancer, we got to worry about cancer. But keep in mind, only 1 to 5% of these people Hep C victims develop cancer or liver cancer. So what we try to do is once we discover it's there, or the potential for it to be there, we try to treat it. And the ways we can treat it and keep it from getting worse and keeping from expanding throughout the body. Next page. Okay, the diet is very, very critical when you're talking about Hep B and C. We like to have a lot of raw vegetables and fruits and legumes and grains, things that are raw and fresh and really easy on the body. We want to do, if you're going to do meat, we want to do low-fat types of meat. We don't want heavy saturated, give me that big old tri-tip full of fat, because that causes liver inflammation. Margarines cause liver inflammation. French fries and getting all those fried foods are very, very hard on the liver. So we want to be easy on the liver with foods that you shop the perimeter of the grocery store again, that are very, very natural, without chemicals, and fairly unprocessed. We also like to see raw vegetable juice. Beet juice, carrot juice, lots and lots of greens going in there. I know we have a place in town, Sugar Magnolias, that makes wheatgrass and lots of green drinks. But if you have your own juicer, you can juice these types of drinks. What they do is they get the liver flushing and moving. You can do cooked artichokes. Artichokes can help increase liver bile excretion, so the liver can clean itself a little bit better. They also aid digestion, but cleaning the liver that way. Lots of nuts. We want to try and reduce the inflammation in the liver as much as we can with the diet, and things like walnuts, almonds, pecans, fish from an uncontaminated source reduce the inflammation in the liver and actually the rest of the body for other issues as well. Avoid all junk food. Get rid of it. Sugars, gone. White flour, junk, gone. Unless you want to be that 1 to 5% that develops into liver cancer, or that 10 to 20% that develop into cirrhosis, diet is paramount if you're trying or have been diagnosed with hepatitis B or C and you're trying to keep it from being able to turn into cirrhosis or liver cancer. Now, there are a lot of supplements that have very, very good testings on them that I have seen bring a lot of my customers into no longer detectable amounts of the viruses, and they no longer have the symptoms or elevated enzymes. And a lot of these have published studies on them, American and British, particularly British journal studies. And so I'm going to go over a few of these supplements that you can research yourself a little additionally that can help with the hepatitis B or C exposure. Milk thistle. 3 to 500 milligrams, and that's a milk thistle extract that we want to do. There's some studies that showed a 90-day period of study that showed reductions, 15% decrease in AST and a 23% decrease in ALT. These are liver enzyme measurements that we use that are, you can statistically graph them and measure them, that tell us how the liver is doing. Milk thistle is milk thistle. It's an herb. It comes in pill form, liquid form, pill form, and a standardized extract, and this dosage is usually recommended. So very helpful for liver enzyme function, and it's a very strong antioxidant for the liver as well. Ester C. I have come across several research papers and other things that in different countries actually that support the usage of a buffered type of C, ester C, calcium ascorbate Cs, used in higher dosages, particularly 2,000 to 4,000 milligrams twice a day, literally increased glutathione levels substantially in the liver and literally have been known just themselves to act in a curative fashion for hepatitis B and C. So, number 1 and 2, if you're going to do supplements, those are the first 2 ones I would look at and research in that regard. A lot of good research coming out on licorice root, 500 milligrams 3 times a day. It literally locks the virus, as I noticed, the Hep B, into the cells to keep it from spreading further into the liver. So extremely antiviral. Licorice can also be used for the herpes simplex virus as well, too, for people who get the little cold sores. Seems to do that same type of antiviral action. A good quality multivitamin. Most of the people that come in that I see, they're jaundice, or they're getting their liver enzymes are all out of whack and all of that. They're not even on a good multivitamin. And even the American Medical Association says that everybody should be on a good multiple vitamin because our food ain't cutting it. This isn't 75 or 100 years ago where we had natural farming. We have commercial farming and very little is put back in the soil and very little is rotated out. So that good multivitamin is very important. A good quality multivitamin, one you know that's going to absorb. Fish or flax oil. You know, we talked about the nuts as being extremely anti-inflammatory. Well, fish and flax are as well. And actually have some studies we discussed before on kidney inflammation, flax oil did, that could reduce it as much as 40%. Works very, very similarly on the liver to help liver inflammation and actually inflammation in the other parts of the body as well. It raises something called prostaglandin 1, which reduces inflammation. Bromelain. Bromelain, remember that fibrin I talked about on the other page? Bromelain kind of eats that fibrin up and prevents things from being sticky. It eats up scar tissue. And boy, I'll tell you, if you can get some of that scar tissue down, you can prevent that enlarging of the liver and free up the liver to perform its over 500 functions that it has to perform, including processing blood sugars, hormones, detoxifying the body. I mean, it's endless on what the liver has to do. So bromelain does help with reducing inflammation, must be taken on an empty stomach, and you need a high, what's called GDU level on bromelain. Artichoke, we mentioned eating artichokes. Artichoke itself increases liver function and helps with bile excretion, cleaning the liver. We also have seen that used to help lower cholesterol. Since 75 to 85% of cholesterol is produced in the liver, artichoke can help with that as well. Berberlum, Oriental medicine, it interferes with the replication of the virus, the reproduction of the virus. N-acetylcysteine, the strongest liver antioxidant, N-acetylcysteine, which converts into glutathione, either of those are one of the strongest antioxidants known for the liver. It pretty much takes carcinogens and makes them inert in the liver. So the body can, from its food, manufacture its own and from adequate amounts of vitamin C. But when you've got an issue like Hep B or C, adding in additional amounts of N-acetylcysteine or glutathione help with the detoxification of the liver. Beta-glucan. Beta-1,3 glucan helps the microphalanges in the body identify the friend from foe. They're kind of like having, you have a whole bunch of soldiers, but when you take the beta-glucan, you end up with a whole bunch of Navy SEALs. They can go in and identify a friend from foe and much more readily see, we got a Hep B or we got a Hep C virus here. We need to attack it and destroy it. Alpha-lipoic acid, very strong liver antioxidant, also helps with some of the blood sugar issues we may be seeing going on with the Hep B and C patients as well. Selenium, studies on selenium for Hep B and C sufferers for prevention of the Hep B and C from becoming liver cancer. Selenium in a no more than 200 microgram dosage can help with that as well. We kind of reviewed the testings and making note that it's kind of guesswork in that regard. So getting tested and retested again, and then also to some warnings. If you are on a drug that you know is hard on the liver and you have any potential for a hepatitis C exposure or hepatitis B, I would strongly encourage you to always get your liver enzymes checked, and rechecked. Watching the immune system. Oftentimes physicians will put you on a cholesterol-lowering drug and they won't check those liver enzymes every 3 to 6 months. That liver needs to be in the optimal, best Health. Certain medications, as I mentioned earlier, can give false readings, and I don't have time to go into all the details of all the different medications, and you can look them up online. But when you get your prescription, look at it, and hopefully it has something in that regard, an explanation what tests it can particularly throw off as well. I hope that this encourages you to do further research and look into it for yourself. There's a lot of information online and a lot more studies and a lot more other stuff that I didn't mention in this particular lecture. Next, we're going to be moving on to our physical fitness portion of our show. Welcome to the fitness portion of our show, and I don't get on the floor for everybody, but I really want to show you this exercise that I really think can help you with pinch sciatica, and that's provided that you don't have a complete deteriorated disc or a disc missing or a fused back. But just for the simple aches and pains of that pinch sciatica, the sciatica nerve will run from that lower back and it'll run down the back of the leg, down the knee and down, and you'll feel pain sometimes all different areas and ranges along the leg. What you do is you get yourself up against a wall and you get your legs in a 90-degree angle. For those of us that remember the geometry, we like a 90-degree angle. What you're going to do is you're going to push up against the wall with one leg. So let's say, for example, I'm going to push up against with this leg, and then I'm going to take this other hand and I'm going to resist the other direction. So while I'm pushing up against the wall, I'm resisting with this one. Okay, and I'm going to hold it for like about 30 seconds. Okay, and then I'm going to switch. I'm going to push this leg and exert force up against the wall, and I'm going to resist with this one with my hands and hold that for 30 seconds. And what you want to do is you want to do it a couple of times on each side. Do it 2 to 3 times a day. And I've noticed, I was a professional trainer for a lot of years as well, and I've noticed definite improvement, or if not a total getting rid of that pinch sciatica within just a day or two. This is no substitute for visiting a good chiropractor, but I'm hoping, at some point though, if you just got a little bit of a singed nerve, you can't get to your chiropractor right away, that this can be a way that you can help alleviate some of that pain. Next, we'll be moving on to the research portion of our show. Hi, welcome to the research portion of our show, and with us today as usual is Ralph Turchiano.
And thank you for that intro. Well, expectant mothers, often you're told that your diets really don't make too much of a difference while being pregnant. Well, there's some information that may end up changing that just a little bit, and it has to deal with diabetes. What researchers found out, and this is released in the September issue of the Journal of Lipid Research, was when experimenting with mice, remember not humans yet, but with mice, when pregnant mice were fed high saturated fat diets during their pregnancy, the children of those mice were greatly enhanced or had much greater potential of having diabetes than mice which were not on a high saturated fat diet during that time. But what surprised them even more was this. Even if the children of those mice did not have diabetes, the grandchildren of those mice also had a higher incidence of diabetes. So this problem began to continue its way down to the generations, where even if those children were eating good diets, their chance of having diabetes was greatly enhanced. Greatly enhanced. So they said even if the mouse goes off a high-fat diet and it's young or never directly exposed, you increase your chances of having diabetes. Now, they also know, too, when pregnant mothers are malnourished, the chance of hypertension and cardiovascular disease and other things alike also increase. Now, keep in mind, malnourished does not mean starvation. Malnourished generally means poor diet. So it's something that plays a huge role and for literally generations down the line. Now, when it comes to cholesterol, We all hear about high cholesterol being bad. Very often, very rarely, we never hear of low cholesterol being bad. Well, there's a new study out that comes out of the Hong Kong Institute of Diabetes and Obesity. What they discovered was this. Now, they tend to use millimoles as far as their cholesterol counts. These numbers may be a little off. When they found out that people's cholesterol was as low as 2.8 millimoles, which is about 110 in your normal LDL cholesterol level. So keep in mind, 2.8 on the LDL, not the total. They discovered, in their words, that both associated with markedly elevated risk of cancer among patients who did not use those statins when they were down to 2.8 or below. Remember that number too, because it's important. They found that elevated risk of cancer in patients with low LDL was linked to cancers of digestive organs, the peritoneum, genital, and urinary organs, lymphatic, blood tissues, as well as other areas. And that was about 110, as your normal count you use in the United States. The doctors greatly stress the need to reanalyze how they market cholesterol as far as being good or bad for you. Keep in mind, too, to be fair, high cholesterol levels are also related to a lot of cancers, too. So it's about a range, not going too low, not too go high. And by the way, the reason I asked you to remember that number 2.8 millimoles was because the Mayo Clinic's recommendation, which I do like the Mayo Clinic, but the Mayo Clinic's recommendation for maintaining a healthy cholesterol level was 2.6 millimoles, or about, I should say, 100 is your total count of LDL. So ironically, the Mayo Clinic's recommendation for cholesterol, LDL, in those with heart disease also happens to be well below the range required to spur cancers and diabetes on top of that. Something to keep in mind, and all these researchers want is just a reanalysis of the data to make sure that they're not actually hurting people instead of where they should be helping people. Now, sticking along those diabetes lines, what would you say if you were a diabetic that was dependent upon insulin, and then insulin may end up being a thing of the past? Doesn't mean it may not be a medication, but researchers at the UT Southwestern Medical Center have discovered something incredible. And this is what they discovered. When they took terminally ill rodents, again, mice, with type 1 diabetes, they found they were restored to full health, not with insulin, but with leptin genes. Just one injection. And this is what they found out. The fact that these animals don't die and restore to normal health despite a total lack of insulin is hard for many researchers and clinicians to believe. UT medical researchers also said this. Many scientists, including us, thought it would be a waste of time to give leptin in the absence of insulin. We've been brainwashed to think that insulin is the only substance that can correct the consequences of insulin deficiency. Again, this is one single injection of leptin genes. On top of that, they said, quote, the animals that received the leptin gene began producing excessive amounts of leptin, which, keep in mind, reversed all the measurable consequences of type 1 diabetes, including weight loss, hyperglycemia, and ketoacidosis on top of that, plus a ton of other metabolic issues in addition to just those. They said, and this was Dr. Yu who had the research, said these animals were actually dying. But if we gave them the leptin gene, one injection, within 2 weeks, the terminally ill rodents were restored to full health without any other treatment. Now keep in mind, this lasted for quite some time off of one injection. They have to figure out how long it'll last, whether it's healthier than insulin, but it means there may be a little bit of hope out there for people who are insulin-dependent diabetics, type 1, type 2. And because in this current study, researchers tested for the first time whether a single injection of leptin gene given to insulin-deficient mice and rats on the verge of death from a diabetic coma can reverse a severe condition and to prevent the animals from dying. And yes, it did. To their amazement, they didn't even expect it to work. That's called good science. They kept their mind open. Now here's something which is kind of disconcerting. This press release was out there, and it has to do with heart attacks. But not the way you think. Heart attacks in those individuals which have pacemakers. Now, here comes the twist. Earlier this year, a team led by William Maisel at Harvard Medical School demonstrated how a commercial radio transmitter can be used to modify wireless communications from a pacemaker. The reason that's important is concerning that they can actually hack into your pacemaker, change its rhythm, stop it, speed it up. Whatever the hackers want to do to your pacemaker, they can. On top of that, not just pacemakers, drug pumps, neural stimulators, swallowable cameras, and other forms of prosthetics. And they said, you don't think people are capable of doing something like that? Well, in 2007, hackers broke into the Epileptic Foundation's website and decided to post flashing images all across the website in hope of inducing epileptic seizures. So trust me, don't put it past people. They need to start coming up with something a little bit more protective than open Wi-Fi for these medical devices. Kind of scary. Again, Harvard Medical School is the one who discovered it and demonstrated it. They released it not to give people ideas, but to find ways to stop it from happening before it does become a problem. Now, this next one is a little bit of a lesson on why you have to go to the source of a lot of these studies, especially science studies. I have two headlines here. Basically, one says, keep taking statins after heart attack. Study says, released from Reuters. Two, the exact same study released by McGill University. Heart attack patients who stop taking statins risk death. Now, they both generally have about the same amount of information between the two. One says that cholesterol users that suffered a heart attack that continue to take the cholesterol-lowering medication had a 16% better chance of survival, which was true. And in fact, the one from Reuters even went as far as telling you that cholesterol-lowering drugs can help with influenza, pneumonia, smoking, gave you a few of the stock tickers, the name of the companies where you could buy these cholesterol-lowering drugs, the whole lineup. The one interesting thing about the Reuters article, it left out one very important paragraph, one that the whole research article was based upon, and it was this. Using data on British patients who survived a heart attack and were still alive 3 months later, Dr. Stella Dascalapo and colleagues found that those who discontinued their statin medication were 88% more likely to die during the following year compared to those who had never been on the medication. That was the root of the study. Reuters, or at least these editors, William Dunham and Eric Walsh, decided to take this negative and turn it into a positive. Not to help protect people and give information where if they're on a statin that maybe it may not be a bad idea that they talk to the doctor or monitor it if they want to come off, but to promote their stock value. Very responsible scientific reporting from Reuters, all the way. I urge you to research yourself. Go to McGill University's research site, look at the study, and take it up for yourself. Thank you.
Thank you very much, Ralph, and thank you very much for joining the Fit and Healthy Today show. We hope this once again encourages you to do further research, both on hepatitis B and C, as well as what Ralph discussed today. Thank you very much.